Toronto Public Health has just paused school suspensions for some 30,000 students under the Immunization of School Pupils Act, and it sounds generous, but if this were truly an urgent health threat, why pause that at all? Because this is exactly what happens when you have united noncompliance. So let's dig in. After massive noncompliance, Toronto Public Health dropped a news release announcing they're pausing suspension orders under the Immunization of School Pupils Act for the rest of the school year. It may sound benevolent, as though they're doing us all a favor by letting kids catch up on their shots and simultaneously stay in class. But a closer look, and it's clear that this update proves the entire fiasco known as ISPA, or the Immunization of School Pupils Act, isn't really about health or safety, but rather compliance, control, and feeding a massive vaccine database that tramples on privacy rights and the very laws meant to protect non-consensual personal health information solicitation. First of all, let's look at what Toronto Public Health themselves are saying. They were looking specifically at children in grades 2 to 5, so a very small cohort whose records were missing. They started the year with over 50,000 students' records not up to date. And even after some catch-up attempts, there's still about 30,000 kids hanging in the balance, again, only in grades 2 to 5. Now they're hitting pause on suspension orders, claiming it's to reduce administrative burdens on families and schools, boost immunization coverage, and minimize disruptions to learning. But don't be fooled. This is due to united noncompliance with unlawful suspension orders. And to try to stem the tide, Toronto Public Health is offering community clinics without needing OHIP cards, multilingual resources, exemption sessions, and even nurses reaching out directly. Parents are told to check records via the yellow card or log in to ICON. That's Immunization Connect Ontario, the province's digital database, to get the jabs and report them back online. And then, of course, if you're 16 or older, you can do it yourself. It's all said to protect students and the school community and avoid missed school days. It sounds helpful on the surface, but my previous reporting on this topic at stopvaccinecoercion.com outlines some pretty major red flags. After all, if this was truly about health and safety, why the sudden mercy? We've seen the fear-mongering lately with measles cases and outbreaks, but the real story here is the push for data. ICON may seem like a handy tool, but it's also a sweeping government database collecting sensitive personal health information on every single child in the system. At the center of all of this is Ontario's Digital Health Immunization Repository called DHIR. That's another centralized system used by the province's 36 public health units through Panorama, with ICON being the front-facing family database that families and the public can conveniently access and update. Together, these systems reflect an expansion of a province-wide digital immunization system, which happens to conveniently align closely with the World Health Organization's collaborative surveillance architecture as part of their management of existential threats, such as climate change, conflicts, and changes in the impacts of countermeasures, for instance, vaccines and antimicrobials. The World Health Organization's Immunization Agenda 2030 strategy emphasizes that immunization and disease surveillance are core capacities under the newly updated international health regulations, and all of this is central to advancing their Sustainable Development Goals. However, in Ontario, Personal Health Information Protection Act is supposed to be in place to safeguard personal health information from this kind of globalist framework. An individual's health data is supposed to be protected and confidential if they so please. It's meant to be collected, used, and disclosed only with strict safeguards, consent where needed, and for legitimate purposes. But forcing parents to upload vaccine records or face suspensions, that's coercion, plain and simple. Past data breaches in Ontario's vaccine systems, like the 2022 COVAX hack affecting hundreds of thousands of people, show how vulnerable this information really is. Names, phone numbers, and health statuses leaked. And now with ICON, they're building an even bigger database. This disrespects PIPA by treating our kids' private medical info like it's public property, all in the name of safety. And then there's the Education Act, which the ministry is supposed to be bound by. In Ontario, lawful school suspensions are meant for serious misconduct like bullying, bringing weapons to school, and making threats. It's not meant to punish families for making personal medical decisions. Suspending students because their parents refuse to consent to the collection of their children's sensitive, private, and at one time confidential medical information, and then its entry into a centralized database isn't part of that act, especially when centralized health databases have been repeatedly shown to be vulnerable to breaches and leaks, with stolen medical data fetching far more on the black market than credit card numbers. It's more important than ever before to protect this data. The Education Act was designed to prioritize access to education and inclusion, not exclusion over data collection, which is not a suspendable offense anyway. A suspension isn't about safety, it's about punishment for noncompliance. Repeated orders can keep kids out of school for 20 days at a time. That's a month of disrupted lives and learning. But now with this pause, they're admitting the system's broken, yet the requirements stay in place, just paused. Why is that? Because the goal isn't healthier kids, it's fuller databases. Tying all of this into the bigger picture, it gets even more absurd. Ontario students are bombing on EQAO tests. That's the Education Quality and Accountability Office assessments. Just look at the latest results released back in December. Only 51% of grade 6 kids met the provincial math standard, and 58% of those in grade 9. Reading and writing, they aren't much better, with overall progress called insufficient by the Education Ministry itself. After years of lockdowns, remote learning disasters, and mental health crises, our kids are struggling academically like never before. Half of them can't meet basic standards, and public health instead is laser focused on vaccine records, chasing database entries, threatening suspensions that could add even more missed days and compromise learning again and again and again. This proves it's not about health or even education. It's about control, tracking, and enforcing compliance at all costs. Rights are like a muscle, and if you don't exercise them, you lose them. So while exemptions for medical, conscience, or religious reasons are still an option, public health makes you jump through hoops like education sessions and legally binding compelled speech affidavits to get them. Don't be bullied into feeding this database without question. For Rebel News, I'm Tamara Ugolini. If you believe children should never be compelled to surrender their private medical information in order to access their basic right to a publicly funded education, please show your support to end this coercion at stopvaccinecoercion.com. That's stopvaccinecoercion.com.